next topic would be for international or foreign grad nurses. Your choices are supply emotional support, maintain relief of pain. Number 3, provide for fluid replacement. Number 4, obtain respiratory therapy. So let's crack the questions and see what we can help you with by using the Maslow's hierarchy of needs. Okay. Number 1, supply emotional support. If the nurse supplies emotional support, which needs are being met? Is it physical or psychosocial? Psychosocial. Emotional needs, psychosocial. So eliminate that right away. Number 2, maintain relief of pain. All right? If you give medication to a client or a patient, which needs are you meeting? Are you providing? Physical or psychosocial? Physical needs will always take priority over pain. And pain is always a psychosocial need. Physical needs will always take priority over pain. We're using Maslow, we're going to eliminate this number 2 because pain is psychosocial need. Number 3 answer choice is provide for fluid replacement. Is giving fluids physical or psychosocial? You just have to think. Maslow's and critical thinking. Is giving fluids physical or psychosocial? Very clearly, this particular answer choice is meeting the physical. So we're going to leave it for consideration. Number 4, obtain respiratory therapy. Is providing respiratory therapy meeting physical or psychosocial? It looks like this is also physical, but we're going to leave it for consideration. So we're trying to choose from 3 and 4. Your choices now is 3 and 4, but you have to be quick in this. I'm just doing this to you so that you're trying to be familiarized with this particular question. So, but you gotta be quick in doing this. Now we have eliminated 1 and 2, so you're left with 3 and 4. You have to ask yourself a question. Does it make sense to give the patient fluids? Yes, it does. She's bleeding. He's hemorrhaging. Another thing you gotta ask number 4. Does it make sense to give the patient or the client a respiratory therapy? No, it doesn't. No, it doesn't. The client is breathing okay, but just bleeding. So between those 2, your answer is number 3. Number 3, provide for fluid replacement. So this is the typical kind of question in the NCLEX exam. It lets you use your knowledge of Maslow's, at the same time it lets you use your critical thinking. You're going to get more of this kind of question. This is just a sample. This is the typical question in the exam. This is the last question. Let's discuss about this alternate question types. You've seen the sample, right? You probably listened to the choices, the answer choices of the alternate question types. Before I go to, discussing the question, let me just remind you, alternate question types, there's actually 3 types. The one that I gave you an example, which is a multiple choice question. It asks you to select more than one response. And then there's fill in the blanks also. Number 3, there's hotspot. The hotspot and fill in the blanks, they're not there. Why? Because the exam is not actually high tech. No, so none of those things are there. Just this particular question that I'm showing you. This particular sample that I'm showing you is there. Okay? So let's discuss what it entails. If you see the word select all that apply, you see boxes before the answer choices, it is alternate question types. If you have 6 choices, that means you have 3 answers. If you have 5 choices, that means you have 2 answers. So remember this, you have to check the box, all of the correct responses, not just the best response. So, number 1, check exposed skin for insect bites every 4 hours. That is the correct answer. Okay. Number 2, get tested for Lyme disease. Nope. This is incorrect because initial symptoms of Lyme disease does not occur from 2 to 30 days. And the test is not reliable for 4 to 6 weeks. So that's out of the question. So remember, I always remind you that you always check the box. Check all the correct answer, not just the best. All the correct ones. So you have got number 1, right? Number 3, remove ticks. And then, you don't do that, right? Remove ticks by crushing them against your skin. No. It is incorrect. It's an incorrect response. Number 4, reapply insect repellent every 4 hours. Number 5, wear dark clothing. This is incorrect. Wear dark clothing? No, that's not correct because you cannot see the ticks. The ticks is color black. So that is incorrect. Number 6, wear long pants, socks, and long sleeve shirts. That is correct and good answer. So in this particular question, you have 3. So 1, check exposed skin. 4, reapply insect repellents. And 6, wear long pants, long sleeve shirts. 1, 4, and 6 are your answers to this particular question. The only thing here is that you're going to go multiple choice question with 1 answer, and then boom, this one appeared, and you have no knowledge about it, right? So the tip is that you see the word select all that apply. You see the boxes on the answer choices. That means you need to check them. And then when you're done, hit N as in next and move on. You cannot, like in the exams that I've done, the investment exam, I jot down the numbers and I go back to it. This particular exam, you cannot do that. You gotta, when you move on, you cannot go back and change your answer. No. So that's the difference. This is a very tricky exam. This exam is not joking. You can do this. You also need to be positive. Think positively that you're gonna make it. I'm glad that you guys are watching this and listening, and because it's a complicated examination. In the big picture of things, this is important to you. That's why I'm putting time, putting videos, the knowledge that I learned being the executive of these companies, test prep companies. So yeah, I promised you that I will inform you why I did not post for almost 3 years, because I got tons of emails, by the way. Where are you? Where have you been? Couldn't do it, you know. My mother was 100 and something years old. My mother-in-law was moved to the home care. During my corporate life, we eat in her house. To make the story short, she was in a home care. She cannot eat on her own anymore. And whenever I'm in town, I just drive to that place and feed her lunch. At least lunch. And my husband does dinner. You know, doing those kind of things to give back to the old folks, if you have. If your mother and your grandma are still alive, you can do that. I mean, I particularly chose to do it. And when I travel for work, I visit my mom, stay there for a month, and make sure she's okay. But she's okay. She's got people to on the clock taking care of her. And those women, my mom and my mother-in-law, passed the last couple of months. You know, so it's an emotional part of roller coaster, part of my life. So yeah, that's it. We're back to moving our lives, and I chose to do this. I chose to do this because I know a lot of stuff. So, and the next topic would be for international or foreign grad nurses. So that would be the next topic, is everything and all the things that the foreign grad nurses will need to do. What's the required exam, what steps they need to do, that kind of thing. So watch out for that. Again, thank you very much. Appreciate your continued watching, continued subscribing, and yeah, see you next time. Sayonara.